If we add some ligaments to this back end of the pelvis, and have some attachments from the sacrum to the spine and to the tuberosity, we're actually going to create some extra openings in the posterior pelvis. So let's just add those. Our first one is called the sacrotuberous ligament, and I bet you can guess where that attaches. There's another muscle that forms part of the wall of the pelvis internally that exits through the greater sciatic frame, and that's piriformis. So let's add that to both sides. Okay, and reorient ourselves. Da-da-da. So here we are arising from the sacrum and exiting through greater sciatic foramen. Okay, so both of these muscles are part of the wall constituents, but they're exiting the pelvis through different bony regions. Okay, so let's just spin ourselves around and take a look at these muscles from the back and get a sense for where they're running. Okay, so you can see obturator internus is weird. It's sort of an L-shaped muscle. As soon as it gets through the lesser sciatic foramen, it turns almost 90 degrees. And it ends up coming over and attaching on the femur. Stabilize the pelvic floor, and since it has attachment on the coccyx, there's going to be flexion of the coccyx because it's going to be pulling in the anterior direction. So who remembers some of the muscles of the pelvic floor? Coccygeus, I like that one. Okay, so let's add both of our coccygeus muscles, left and right. And you can see on this, from this side anyway, we have an attachment from the coccyx over to, here we go. And let's just move him around a little bit so we can really get a sense for where he starts and stops. Okay. And let's see if we have a perineal membrane in here. Got it. Okay, here we go. So as our pudendal nerve made it around the corner here and just sort of joined up with obturator internus and the external anal sphincter muscle, so that branch comes off relatively quickly, often before the nerve even reaches the pudendal canal. Okay? If you follow the pudendal nerve forward, and we can sort of turn it around so we're looking more at the urogenital triangle now. Here was that inferior anal nerve or inferior rectal nerve. The pudendal nerve continues and becomes the perineal nerve. Got you. Yep. So let's just sort of draw this around. So that's exposing the pterygomaxillary fissure. And if we sort of go in far enough, you're going to see this little ball in here. That's our pterygopalatine ganglion. Okay. From there, we can sort of take a look at the distal branches of V2. You can see there's a hole medially, and good luck ever finding this in a cadaver, that the branches go through to get into the nasal cavity. This would be the sphenopalatine foramen. These guys over here are going to be your posterior lateral nasal nerves. So you've got some over here on the inferior concha, and then you've got a couple up here on the superior concha, supplying the lateral aspect of the nasal cavity. So through those V2 branches, we've been able to demonstrate both the medial and lateral innervation. Okay, so I'll just sort of reiterate. If we're in the nasal cavity, this is reflecting sort of a really challenging three-dimensional concept that is difficult to deal with in a two-dimensional medium. Your pathway of nasopalatine as it crosses through the nasal cavity towards the septum. There's really no one two-dimensional image that's going to depict that for you very well. Likewise, you have your lateral nasal branches over here. Why don't we come over to the infraorbital nerve, another branch of E2, and you can see that if we mouse over it, we're getting the information about what nerve we're looking at, and we can tell which bones we're also looking at the same time. And we can actually just sort of zoom straight on through here, and that should take us all the way back to where we saw the infraorbital nerve in the first place coming off of the pterygopalatine ganglion in the pterygopalatine fossa. So let's correlate some of what we're seeing here in terms of bony anatomy, nervous anatomy, with radiologic imaging. I think that's a really useful tool here. So and let's just bring up the imaging interface and see how that looks with the 3D on. I'll just bring this down too.